Under Government Bills and Orders for third reading, Bill 30, Mental Health Services Protection Act. The Honourable Ms. Hoffman.
The Honourable Minister of Health.
Thank you very much, Madam Speaker. I think I will give the floor to my colleagues to enter into debate and save my remarks for closing on third. But it's my pleasure to move third reading of Bill 30 at this time and welcome my colleagues to join in with their questions and comments. I think we've had some fruitful conversation earlier today and look forward to that continuing as we make action to improve and execute the commitments that we've made both in the throne speech that were recommended through fatality reviews and that we know many members of the mental health community have been advocating for years. I'm proud to be a government that makes promises, keeps them, and works to make life better for families, and certainly the families that we've heard from accessing mental health services in times of extreme nervousness, chaos, uncertainty deserve every certainty that they are being well served, protected, and that the professionals that are working with them are held to a high standard, as well as the facilities that they are living in. And I look forward to hearing from some of my honourable colleagues, including the co-sponsors of this very important bill. Thank you.
Thank you, Minister. Are there any other members wishing to speak? The Honourable Member for Airdrie.
Thank you, Madam Speaker, and for the opportunity to speak on third reading of Bill 30, the Mental Health Services Protection Act. This bill consists of two parts, as has been mentioned in this House, and as I have read the bill myself as it reads, the portion surrounding the regulation and licensing with treatment facilities, and then the second part being the creation of a college for counsellors here in this province, Madam Speaker. I'm not sure if I have mentioned this piece before, but this was actually one of the first issues that I contacted my own MLA about prior to being elected out many years ago in response to the creation of a college for counsellors. I think it's important for a number of different reasons. I think most importantly, creating a quality and a standard of care in this province, and also creating more access to quality counselling services. Madam Speaker, as you know, we're facing crisis levels in this province when it comes to that particular issue, and I think this is a good step forward in helping to address that crisis, Madam Speaker. And then in relation to the first part of the bill, in terms of licensing and regulation of the treatment facilities, providing good quality care in the facilities is extremely important for my constituents, but most certainly for all Albertans. I look forward to watching the process as this goes along. I think it's important to watch it very closely. A creation of a college it is a process in and of itself, but we've outlined a number of potential unintended consequences through the course of this debate, and some examples that has been seen in the province of Ontario that's done very similar thing. So I think it's important that we keep an eye on this legislation, see how it rolls out, and watch it and adjust as necessary as this moves along. So with that, I am pleased to support Bill 30, and I urge that my colleagues support it as well. Thank you very much.
Thank you, Honourable Member. Are there any other members wishing to speak? The Honourable Member for Peace River.
Thank you, Madam Speaker. I'm truly honoured today to stand and speak to third reading of Bill 30, the Mental Health Service Protection Act. I'm incredibly pleased to see this bill come forward, as it's something that I've long advocated for. Prior to getting elected, I was working as a provisional psychologist in high level, and it was seeing the consequences of decades of neglect of mental health services by the previous government that spurred me to run for election, among other things. My private member's Bill 205, supporting accessible addiction treatment facilities, addressed the need for an online registry of addiction treatment facilities, and I look forward to working with the Department of Health as this part of the bill is implemented. But I have an even more personal reason to support improved mental health and addiction treatment services. And I'd like to share just some of my family's story to help highlight just who Bill 30 is intended to help. I have a family history of depression, and I've had my own battles with the disease. I've lost family members to suicide and addictions. Depression took its greatest and final toll, however, on my daughter, Amaya. She fought the illness for years. When she was suicidal, we'd sit in the emergency room for hours while a stream of people with visible external pain were seen first. We'd finally give up and go home. As her pain continued with no real relief, she began the cycle of self-medicating. It began with prescription meds, then gradually escalated to more powerful substances. Amaya did not want to be addicted. She just wanted the pain to stop. She tried to get support and help to get well, but every step of the way, she encountered barriers. For example, to get into treatment, you need to be clean. So for days at a time, Amaya would have to show up at detox at 9 a.m. every morning to see if there was a bed. Can you imagine arriving at emergency sick, bleeding, and in pain, only to be sent away and told, "Come back tomorrow, maybe we'll help you then." Trying to get into a treatment facility was equally difficult. There's no easy way to access information about these facilities and find out when and where there's availability. And as we've heard throughout debate on Bill 30, not only are there government-run facilities, but there are many operated by nonprofit agencies and on reserve. There are no consistent standards or guidelines to help individuals know what that treatment might look like, whether it is offered by qualified staff, and whether they can have confidence in the process. And the application process itself is incredibly discouraging. I found it daunting myself to navigate. Can you imagine how much harder it would be for someone who is already desperately ill? The provisions of Bill 30 will go a long way towards improving access, but it does even more. In my experience as a provisional psychologist, I know how important it is that individuals have confidence in their therapists. In terms of effectiveness, the personal relationship between client and therapist matters more than the individual qualifications of the counselor. And whether they're an addictions counselor, a psychologist, or social worker, however, it is essential that these professional titles are protected and recognized. Albertans need the confidence that they are receiving help from someone who is qualified in their respective field to provide it. For far too long in Alberta, anyone could call themselves a counselor. I'm really pleased that this is going to change. By providing legitimacy and requiring licensing of facilities, Bill 30 will help reduce the stigma and move us further towards treating individuals with mental illness and substance use disorders as people with medical problems deserving of the same kind of respectful treatment given to those with cancer or diabetes or any other illness. I think it's really important that we talk about the stigma. The Mental Health Commission of Canada estimates that more than 60% of people with mental health problems and mental illness won't seek the help they need. Stigma is one of the main reasons. In my family, we certainly found this to be true. During Amaya's last months of life, she went to emergency several times, desperately seeking help. She was dismissed as just another addict and sent back out into the street. She told me how horrible she was made to feel by the very people whose role was supposed to be to protect, help, and heal. The stigma impacted me and my other daughters, too. We all felt it. Stigma allows others to distance themselves and say, "It's not me, it's not my family." This creates a fear of reaching out to ask for help and admit that there's a problem. The messaging is subtle. You watch your loved one in pain and you know that they're struggling with an illness beyond their control, but you feel helpless and at times impatient and frustrated with their behavior. Stigma impacts the way health professionals and frontline service providers react. Stigma creates an environment where someone with an addiction is looked down on as being weak, as having made really bad choices, and perhaps even deserving the consequences. Well, let me tell you this. Amaya was the strongest person I know. She fought hard. She wanted to get well. She did not want to give up. She did not choose to have a mental illness, nor did she choose to become addicted. And she has a family who loved her and did our best to support her. My last conversation with her was about a plan to support her in recovery, and she was ready and willing. Amaya was beautiful, kind-hearted, generous. She was an incredibly talented singer, musician, and artist. She had a great sense of humor and was so much fun to hang out with. She leaves a large hole in our family and in our hearts that will never be filled. That is what mental illness and addictions looks like. During the process of researching my Bill 205 over this past year, I heard Amaya's story over and over. I heard from many stakeholders, and I consulted with support groups, healthcare professionals, law enforcement, community elders, and First Nations. I've received numerous letters and calls and was privileged to have individual conversations with many Albertans who shared their own deeply personal stories with me. 1 in 5 Albertans experience an addiction or mental illness, and they're very often co-occurring. It is estimated that 1 in 10 Albertans will require substance use treatment at some point in their lives. Bill 30 takes another step towards addressing concerns highlighted in the 2015 Valuing Mental Health Report and is part of more than 100 initiatives underway across the province. Unfortunately, while starting to implement these recommendations, the government was forced to respond to an opioid crisis, a health crisis of incredible and previously unmatched proportions. And make no mistake, this crisis was a long time in coming and a consequence of years of Conservative government neglect in the area of mental health. In 2017, there were 569 unintentional fentanyl-related deaths in Alberta. My daughter Amaya was one of them. In the first 32 weeks of 2018, 425 Albertans lost their lives to fentanyl overdoses, and we continue to average almost 2 accidental drug poisoning deaths related to fentanyl every single day. That's why it's so important that this bill be passed and implemented without delay, as it will provide yet more support and access to treatment for those dealing with opioid addiction. As part of the spectrum of treatment facilities, I just want to briefly speak about the importance of the supervised consumption services that have been opened in several locations beginning this spring, including at the Royal Alexandra Hospital. These programs save lives, reduce transmission of infections, enhance community safety, and help individuals access treatment. Had these services been in place earlier, they might well have saved Amaya's life. Bill 30 reinforces that our government is committed to supporting Albertans to access coordinated and integrated addiction and mental health services and supports. A better understanding of the co-occurrence of these disorders is needed, along with an understanding of the importance of fair, timely, and evidence-based treatment. Although the provisions of this bill will improve access to treatment facilities and help Albertans have confidence in the safety and quality of the treatment they receive, there's still much to be done to alleviate the burdens and the obstacles facing patients seeking help. When researching my private member's bill, I heard about the many barriers faced: challenges accessing appropriate treatment, need for locations that are accessible, more supports for families and individuals with children who need access to treatment, and so much more. We still need to work to ensure that individuals are treated respectfully and with non-stigmatizing language. Not only health providers, but peace officers, judges, justices of the peace, other frontline workers, and Albertans in general need to be educated regarding mental health, substance use disorders, the co-occurrence of mental illness and addiction, and harm reduction strategies. We need to shift our thinking and perception towards understanding mental illness and addictions as a medical issue, thus helping reduce stigma and barriers. Unfortunately, stigma and shame persist, creating significant barriers for those seeking help. And there also remains a resistance and skepticism to the research and best practices around treatment. Sadly, we've even seen these attitudes coming from the official opposition when it comes to programs like supervised consumption, which have been characterized by their leader as nothing more than helping addicts inject poison into their bodies. Make no mistake, substance use dependency is not a choice. Seeking treatment need many options through which to access immediate care, and we must provide a wide range of support services to help them on the path to recovery, stability, and health. Not only is this essential for the individuals who are ill, but their families also need our support and understanding. Our government is working to build robust services for people living with mental illness and substance use disorders. Bill 30 will continue to build upon that work and ensure that Albertans are aware of the treatment services available to them and are able to access these services with the same level of support we give Albertans with other illnesses. Licensing treatment facilities and regulating the counselling profession also enhances confidence in the quality of the treatment itself. I look forward to working closely with the Health Ministry as they continue to put these concepts into practice and effective delivery of mental health and addiction treatments and services in the province. When I made the difficult decision to speak publicly about my family's experience and about the loss of my daughter Amaya, I did so in the hopes of increasing understanding and improving the dialogue, thus reducing stigma. Mental illness and addiction has serious consequences for each and every one of us. It is a disease, not a choice. We need to openly discuss the nature of mental illness and substance use disorders and educate ourselves about addiction. Individuals with addictions and mental illness are our daughters, our sons, our parents, our neighbours, our co-workers, our brothers, our sisters. They need our support and understanding so they can freely seek treatment and manage symptoms without facing roadblocks and stigma. We need to help them get well and ensure that they are always treated with the dignity and the respect they deserve. Thank you, Madam Speaker.
Thank you, Honourable Member. Are there any members wishing to speak under 29(2)A? The Honourable Member for Saskatchewan. Fairhill.
Thank you, Madam Speaker. I just wanted to take the opportunity to thank the member for sharing an incredibly personal and an experience that none of us would want to have to go through. A number of us were able to come and attend your daughter Amaya's funeral, and it was one of those moments where we realized how small the world is. I didn't know that friends of mine were friends with your daughter, and so I had the opportunity to support not only you but my friends at that funeral. But the things that I remarked on, having the opportunity to share in that and learn a bit about her life, seeing her as a friend and a daughter, an artist and a performer, those things, it's tragic to feel that loss in a community. Our Health Minister, Deputy Premier, was just remembering the video that was shared of your daughter singing "The sun will come out tomorrow," and it was an amazing moment to be able to share with you the things that we fight for in this House that there was no movement on before, having a premier and an NDP government to move forward things like harm reduction services and emergency housing having more resources being allocated to that, because people find themselves in very compromised and tragic circumstances, and we need to be able to do more to support those people. And I'm so impressed and honored to be able to serve in this legislature with you, because your ability to continue to advocate on these issues and be such a powerful voice to help us continue to do this work, even when faced with such incredible loss, is an example for us all to look up to you for. And so thank you for that. And if I had to offer another song, it would be "You'll Never Walk Alone" by Rodgers and Hammerstein, I think is the name of the writers. And because you're part of this team, and we share the same values, and we fight for the same things, and we always have your back. And so we're here for you. And thank you again for sharing an incredible story. Thank you.
Under 29(2)A, the Honourable Member for Calgary McKay-North Hill.
Thank you, Madam Speaker. I just wanted to take a moment to acknowledge the incredible strength and courage and leadership shown by the member in sharing such a personal story. All of us being able to share what our experiences are is the kind of example that we need to set for Albertans, that the experiences that we have are the experiences that they have. And I'm in complete agreement with the member about the approach to treating addiction. It shouldn't be a fight, it should just be common sense. It should just be a fact that we provide the kinds of services that are required to prevent and treat addictions. And once again, thank you very much for sharing your family's experience.
Thank you, Honourable Member. Are there any other members wishing to speak under 29(2)A? The Honourable Member for Calgary Shaw.
Thank you, Madam Speaker. With the abbreviated time that's available, I want to thank the member for everything she did to contribute into the ministerial panel after this had occurred. She brought her experiences to the table. I think we're seeing that in the legislation that we're bringing forward because she had a very unique perspective to what was at the table. And because of that, our child intervention system is going to be better off for it too. So I want to thank the member for all that she brought to the table and continues to bring to the table as we discuss legislation in this House.
Thank you, Honourable Member. Any other members wishing to speak under 29(2)A? Seeing none, are there any other members wishing to speak? The Honourable Member for Edmonton Centre.
Well, thank you, Madam Speaker. I appreciate the opportunity to take a moment to talk about this bill, Bill 30, the Mental Health Services Protection Act. Mental health has been a chief focus for me in many ways in my time as an MLA over the last 3.5 years. And so I really appreciate the steps that we've been able to take as a government, and indeed the leadership that the Minister of Health has shown on many fronts, and indeed the former Associate Minister of Health and now member for Calgary, Acadia. And so I really appreciate the opportunity to speak to this bill. I'd like to begin by acknowledging, as others have, the powerful words that were just shared by my colleague from Peace River. Indeed, my sympathy goes out to her. I've known far too many, and still know far too many people, that have lost loved ones because they've been unable to find the help they needed, when they needed it, for whatever reason that might be, and unfortunately decided that their pain was too much. So my sympathies are with her, and I thank her for her leadership in bringing forward her private member's bill, which is along the similar lines to a lot of what we're debating here today, in wanting to lay out a patient's bill of rights in accessing mental health supports or help in addressing substance use. And for much the same reasons as we're laying out here, because we want to recognize that those that are seeking those supports and those services deserve to be able to access them in dignity, in safety, free from stigma. And indeed, as this bill lays out, to be able to access them from people that they know when they claim that they are offering a level of professional service, that indeed they have the training and understanding and the qualifications to be able to do so. Now, I wanted to address some of the comments that were made this morning when we were debating this in Committee of the Whole. As I listened to the members, I had several thoughts come to me, and I wanted to comment on a few. So the member for Lacombe-Panoka was speaking and expressing his concerns about limiting choice available to individuals who are seeking help. And he spoke specifically about excluding options in accessing supports for counseling for mental health and addictions. He spoke of his concern that we were going to restrict them only to government-approved services, and the lack of knowledge about the quality or the efficacy of those services that are being provided. And what occurred to me, Madam Speaker, is that, you know, I've spoken openly often about my own struggles with mental health. One of the things I maybe have not spoken about as much as my own challenges with physical health. So for a number of years, I've struggled with severe food intolerance, a number of other symptoms, a number of other issues. I spent a lot of time going to a lot of different doctors, medical doctors, specialists, getting all of the medical tests run. When I exhausted all of those and nobody could provide me with any insider help, then I saw many naturopaths and many doctors that worked in alternative medicine and a whole gamut of other people, because I can tell you, Madam Speaker, when you're in that situation and feeling that kind of desperation, you'll look for any opportunity for help. But the fact is the fact that I had to go through all of that, and that I ended up finding help through a lot of my own research, and indeed by going outside the system in many respects. Indeed, I ended up finding a naturopath who had an understanding who I could work with, and I've seen a great improvement over the last couple of years as I've worked with him. But the fact is, I am still very glad that that naturopath works with the college and is regulated. You know, I may cut myself and be able to bandage that wound myself. I may be able to get help from a friend or acquaintance who has a little bit of medical knowledge. I could have a sore throat or a pulled muscle. I could have a chronic problem with headaches. And maybe there's an herbal remedy that I might hear about from someone that might help me with that situation. Or I may even be living with chronic pain, diagnosed, and simply looking to an alternative to going on a heavy course of opioids or other painkillers, and instead find help maybe through meditation or mindfulness or group therapy or other things that might help me. But the fact that those other options exist do not preclude the fact that we need to regulate the medical services that are involved and the medical people that are involved in those things. Those things can all exist simultaneously. It is similar with mental health. Now, as I said, I had my own struggles, and through the years, I saw a number of different individuals in looking for that help. Starting out as I did as a young man coming from the faith community, I was sent to see a man who was, I believe, a psychologist. But you know, when I first went to see him, he told me that I was oppressed by a demon and wanted to work with me on that front. And when we finally found no success, then he referred me to a psychiatrist. And I saw that psychiatrist, and I will be honest, I was not an easy person to diagnose. I was not very able to communicate very well because I was in a state of pretty dark despair, severe anxiety, without any language of knowing how to communicate what I was experiencing or what was happening to me, because all I knew was what I had lived and grown up with. She diagnosed me with schizophrenia. Didn't tell me that. I found that out later when my family doctor saw the medical records. Tried me on a few different medications, and I'll tell you, there were some pretty freaky side effects that put a lot of fear into me and made it a lot worse in some respects. It was a long journey. That started out in 1991, 1992. And I saw all manner of therapists, counselors, individuals. I can tell you, Madam Speaker, as I said, I recognize the need to have different alternatives for different places where people might be. Somebody who's struggling with alcoholism may benefit from a 12-step program. Some people go cold turkey. They're perfectly fine with working that out on their own. Others need to go into a medical facility and sit down with folks who have the training and the knowledge, who are able to provide them with that support. Same with people who are struggling with their mental health. Somebody who's struggling with anxiety or depression, maybe because of experiences growing up or trauma they've experienced, maybe talk therapy is going to be good for them. Maybe for them, sitting down with their imam or their pastor or a yogi is going to give them the ability to talk that through and work those issues out. But for others, they may need professional help. They may need a dedicated program, like I had the honor of participating in the day treatment program at the University of Alberta Hospital, where I got to spend just over 3 months with trained therapists in an approved and accredited program that helped me begin to lay the groundwork for, frankly, years later, when I would be able to actually start to pick up on some of the things that I heard and was taught in that room and be able to implement them to improve my own life. But it's essential that when people in this incredibly vulnerable state, and let me be clear, Madam Speaker, when you are in this place, you are so vulnerable. When your mind is racing, your emotions are out of control, you have lost all perspective, and you don't know where you can turn, it is incredibly important that folks who are representing themselves as professional therapists, who are offering services, be regulated. Mm-hmm. That we know that when people are reaching out and asking for help, that the help that they are going to receive from individuals who are representing themselves as such is going to be qualified. particularly for folks that are going into residential programs, where they are entrusting not themselves only just, where they're entrusting themselves physically in a situation of incredible dependence and indeed trust. We want to be sure that the provision of those services is being done in a safe and regulated manner. So I deeply appreciate the work that the minister has done on this, the consultation that she's had, and indeed recognizing the work that FACT has done. And I remember meeting with the executive director, her name again was Nicole Imgren. And I remember meeting with her in my office and talking with her, and I really appreciate the hard work and advocacy she has done over an extended period. To be clear, Madam Speaker, this was not arrived at overnight. This has been an ongoing conversation for quite some time. And I deeply appreciate when I see folks in the community who take that time and work carefully in their advocacy, reach out to talk to other groups, to build that consensus and come and thoughtfully engage with government about moving forward on these things. The member for Fort McMurray Wood Buffalo this morning, expressed some concerns around the consultations that have been happening, identified a group that he felt had not been heard. I appreciate that that Nicole's organization, FACT Alberta, clarified that indeed they'd actively reached out to that particular group and that members from that group, in fact, sit on the steering committee for FACT Alberta, and so have had some input as part of this. And I do regret that as the member made his tabling today, he seemed to suggest that both myself and the Minister of Health in discussing these things have engaged in unparliamentary language. I would certainly encourage that member that if he feels I used any unparliamentary language in my comments today, that he bring that to the record, or perhaps would consider at the time calling a point of order. But regardless, I recognize that he's done work in the field, that he himself has probably had some traumatic experiences in his work as a paramedic.
True.
And so I can understand the passion that he brings to the table and wanting to ensure that people are helped. But I think we need to be careful in these discussions, Madam Speaker, to be measured in how we're approaching this, because again, I do not think it's unreasonable that we bring in some basic standards, as other jurisdictions have done before us, so that we ensure that the types of services that are being offered to people are clearly identified, that they can clearly know when they are dealing with somebody who is a professional, who has training, who has background, who has education, has schooling. And again, ensuring that as we do so, we leave the room for these other options that indeed need to be available for people. Because I recognize, Madam Speaker, that over the years, we are just starting to get to the point where we recognize that mental health is every bit as important and as necessary as physical health. And because we have not historically had that recognition, we have not built up the same kinds of systems and indeed public coverage, access. Government has largely been absent from the provision of what are really often key medical services that are every bit as important as a person's physical health. And in the time before we began to recognize that importance, indeed, I recognize that other communities have indeed provided that service, and we are incredibly thankful that that has been there, that people have had the opportunity to talk with, peer counselors, that they've had the opportunity to find spiritual support when that is what they need and that is what they're looking for, that organizations have stepped up and provided, counseling on a free or sliding scale basis. It's an incredibly important network of services that we need to have available as we continue to address the issue of mental health, because we recognize the more we talk about it, then the more people recognize the need. And so indeed, we see growing numbers of people trying to access services, and we just cannot keep up with the capacity to address it. So we need to have folks at all different points on the spectrum of services to help provide people with what they need when they need it. But indeed, I think we need to move forward with ensuring that we have a level of services that are clearly identified and as being provided by individuals who have training, who have knowledge, because we do continue to learn. We do continue to find proven therapies. When we get into psychiatry and other areas, there are definitely proven methodologies and approaches. that we know are effective. So it's important that we have a layer of services that is protected and regulated. And indeed, the creation of this College of Counseling Therapy is not the last step on the road. This is the first step. And so members that have been expressing some concerns about how this might impact other groups, there is room after the passage of this bill to have that conversation. And to sit down and continue to work through regulation as this is established, just as has been done with every other college that has been created in the province. And I recognize that, again, some groups may feel a bit of fear about this change coming in. I can understand that. With change comes some uncertainty. And again, these are groups who've provided important and essential services. But I truly believe, having spoken with some of the folks that have been advocating for this, and I think the opportunity we're going to have to appoint people and see people elected into positions to take on this work, that we have the capacity to do this well and do this right. So this bill is the important first step on that road as we continue to acknowledge the incredible importance of mental health, as we continue to acknowledge the work we need to do to support people who are struggling with addictions in a humane way, with a harm reduction approach that, as my colleague from Peace River noted, is rooted in ending stigma.
Hear, hear. Honourable member, are there any members wishing to speak under 29(2)A? The Honourable Member for St. Albert.
Thank you, Madam Chair. So, like everyone, I'm sure I was just fascinated by what you had to say, or by what the member for Edmonton Centre had to say. So I would love it if he would continue to talk about why this bill is so important and really sort of impressing on everybody what the actual facts are.
Thank you to the member from St. Albert. I'll just conclude briefly. I was just wrapping up my remarks. So again, as we proceed with this, I think this bill is a very important first step on the road, setting up the structures to ensure that we will have the college that will help determine how we regulate, how we protect. We've had some excellent amendments that have helped ensure that this has the minimum of negative impact on those who provide these services while providing good protection for those who need to access them. So I thank all the members that have shared their thoughts on this. I thank the Minister for bringing this forward, and I look forward to voting in support of this bill. Thank you.
Thank you, Honourable Member. Are there any other members wishing to speak under 29(2)A? Seeing none, we have a request for unanimous consent to revert back to introductions. I will ask one question. Anyone opposed? The Honourable Member for Airdrie.
Thank you so much, Madam Speaker, and it's such an honour and a pleasure to introduce to you and through you and to all members of this Assembly the three most very importantest people in my whole life. My husband, Kent, and my children, Molly and Brady. They are here to learn something, as they maybe should be in school, but they are going to see firsthand the proceedings here in this Assembly this afternoon. My husband is wonderful and amazing, and he's here to fix all the broken things over the last year that have happened in my Edmonton residence. And Molly, just so you all know, members, is a wonderful, beautiful, smart girl who is into competitive swimming. She's currently trying to beat my 24-year-old swimming record, and I am certain that she's going to be accomplishing that. And my son Brady, who is a very, very good hockey player, and spent his summer at a camp at the university building a robot that can solve a Rubik's Cube. So I would ask that the three most important people in my life, my loves, please stand and receive the traditional warm welcome of this Assembly. Hear, hear.
Are there any other members wishing to speak? The Honourable Member for Bonnyville-Cold Lake.
Thank you, Madam Speaker. I have to say that whenever we talk about mental health, clearly this is something that I think has touched almost every person's life in this House. I can say that in my constituency of Bonnyville-Cold Lake, suicides has been something that has been a very troubling trend with the lack of work or underemployment. But having said that, I reached out to my local charities or societies that do counseling in my constituency to get some feedback on Bill 30. And I couldn't get to them all, but I did get to a few, and I've got a few responses. But the one that comes forward here that I would like to read to the House, I think that the Minister of Health will be pleased with. It goes on to say, "Hi, Julie," and that's my constituency assistant. "I think that Bill 30 is a good one and will help consumers to distinguish between a real service and one that is just a money grab. As one of the organizations in the region most impacted by this, I would like to see some support and compensation to assist with the compliance, as it will not be cost neutral on our part. Thanks for reaching out and asking for feedback. Much appreciated, Audrey." Audrey McFarland. Audrey is the Executive Director of the Lakeland Centre for FASD. So when we make laws like this, there's going to be consequences. And one of the consequences here is that there might be some needed training or ability for these organizations to be able to react. And I think that she brings up a valid point. She supports this bill, and she says that it really is something that will focus this industry, or not industry, this profession. I apologize. And I think that when it comes to dedicated members of our society, like Audrey, we need to commend each and every one of these councillors that actually are on the front lines doing work within Alberta to make sure that some of our most vulnerable Albertans get the help they need. That is all I wanted to say. Thank you, Madam Speaker.
Thank you, Honourable Member. Are there any other members wishing to speak? 29-2A. Are there any other members wishing to speak? Minister of Justice.
Thank you very much, Madam Speaker. I actually rise just simply to notify the House that pursuant to Government Motion 36, no evening sitting will take place tonight.
Thank you, Minister. Are there any other members wishing to speak to the bill? Seeing none, I will call the question. Oh, sorry, Minister, would you like to close debate?
Madam Speaker, and I want to say what an honour it is to move third reading of Bill 30, Mental Health Services Protection Act. Sorry, I'm getting emotional thinking about all of the work of our entire caucus. I know it's my title that goes on these bills, but they are such a work of commitment with our caucus committees, with our cabinet committees, and this is what happens when you have a government made of ordinary folks that love and care for one another, that work in these professions, and that move things forward that matter and will make a real difference to ordinary families. So to all of my colleagues, I want to thank them for all of their contributions. I know that it's my name on this bill, but it is every single one of us that needs to feel really proud of our accomplishments today. I want to thank the members of the Assembly for adding their feedback through second reading in Committee of the Whole and now in third as well. Madam Speaker, all Albertans have a right to feel safe when seeking support for their substance use or mental health treatment. They should feel confident that they are receiving safe, quality services from licensed facilities and appropriately trained, regulated health professionals. For decades, this hasn't been the case in Alberta. This legislation will introduce licensing requirements and core standards that will protect Albertans who seek help from residential substance use facilities in a much better way than there is today. I also want to thank the member for Vermilion-Lloydminster for his thoughtful amendment in supporting patient privacy. I think when we had a chance to sit down and talk between second reading and today, it was clear that he was wanting to ensure just that patients have a little bit of time to prepare, and that was something that one of the stakeholders that he reached out to said would help. And I appreciate that he originally was thinking maybe bigger than he ended up bringing forward in the amendment, that he understood that if there were safety concerns, we can't exactly call and say we'll be there in 2 hours to check. That if there are safety concerns, it's still important that we have timely access, but that in routine inspections, it's important to think about patient-centered care and how we can give that little heads up for patients. So I also want to thank the members who asked questions about clarifying that the counselling relationship wouldn't negatively impact people with lived experience. The member from Airdrie talked about somebody she knows, I think his name was Mike, and how he's providing important supports to members of his community. So we wanted to make sure that we were crystal clear in the legislation and that peer support and people with lived experience offering that support aren't captured unless they start calling themselves counselling therapists, which of course they won't be allowed to do because it will actually be a regulated title, a regulated professional title moving forward. So I'm really excited about that. And I want to say that ultimately this legislation will ensure that Albertans receive consistent quality care. As we move forward, Alberta Health will work with the service providers to develop standards that prioritize Albertans' safety and security, and this will ensure that the implementation of this legislation does not cause an onerous requirement on service providers that could negatively impact access to treatment. We also met with some members of this House to talk about our hope is that we'll be able to make it free of cost at the beginning, and if there needs to be a cost, that it be minimal as we move forward, but that there not be any cost for moving forward with regulation at the beginning, because we want to make sure that this isn't an impediment to good quality care and that it doesn't result in a reduction of services unless, of course, services don't meet the criteria. Then we don't want them to be available. We want them to make sure that they change their criteria, that they make sure that they're rising to that higher standard. I want to thank the co-sponsors, both the member for Peace River, who is the Deputy Speaker, as well as the member for Acadia, who is the Associate Minister of Health, with a real focus on mental health when we started this work earlier this year. And I want to say that both of these women have brought forward a number of really thoughtful contributions to the legislation itself, as well as the work we've done with community in preparing for today. Specifically, I want to mention, obviously, the member from Peace River talked about her lived experience as a mum, and I know that seeing those pictures, there's no way Amaya, when she was that passionate 8-year-old playing Annie in the school play, thought one day I want to grow up and have an addiction. She wanted to be a star, right? And any one of these kids who comes through this building has dreams and hopes, and it's our responsibility to make sure that we support them in reaching their full potential, that we keep them here another day. So I want to thank the members who have talked about the comprehensive work we've done around mental health and substance use support, in addition to the work that's in this specific bill, because there is no way that it is a choice to it isn't a choice to live with a substance use issue. Getting the right help and the right support to be able to exercise your desire to get treatment, I think, is something that we have an onus to make sure we do safely. So this legislation will reinforce the dedicated efforts and of highly qualified care, as well as ensuring that well-run facilities in our province can say that they're part of the proper oversight that's being given and support themselves and continuing to access additional avenues for support. And this bill will make Alberta the 5th province to regulate counselling therapists and the 3rd to regulate residential substance use treatment. I think that nobody in Alberta should feel that they have any less quality of care than any other province, and I'm glad that we will be addressing it in both of these areas to make sure that we move forward with the patient and the family as the focus. And, Madam Speaker, everyone in this room knows somebody who I think we talk more openly about has mental health challenges or has substance use challenges, but we also probably, every one of us knows somebody who's accessed treatment at some point too. And we know that this is something that will continue to be a need as we move forward, so let's make sure we get it right. The member from Peace River, also when I was with her this summer, we went and visited the Peace River Opioid Awareness Working Group. And I want to say, I know we talk a lot about the honourable member's lived experience, but when we were with this working group, we also heard from other people who talked about the lived experience of people in the region as well. It isn't just somebody's daughter, it was somebody's father. Somebody's father who in the middle of calving season acquired a muscle injury and couldn't afford to take time off, obviously, from this important season to take care of his body, and therefore went and got a prescription. No community is immune from substance use addiction, and it is our obligation to make sure that when people are injured, when people have a substance use issue, that we give them the right supports to be able to move forward and reach their full potential, become what it is that they aspire to be. So I know that Bill 30 will support Albertans who are seeking this support, and I know that some people have said, well, maybe this just isn't the right time. Maybe this will be, too cumbersome or too expensive. The right time was before Taylor passed away. The right time was before 2007. The best day to plant a tree was 20 years ago. The second best day is today. So today I ask that all of us plant a tree, move forward in supporting patients and their mental health needs, and make sure that we pass this legislation. And don't waste any more time. Don't talk about taking 10 years to fully implement it. Let's make sure that we plant the tree today and that we move forward to make sure that everyone gets the care that they need as we all move forward as Albertans. So thank you very much, Madam Speaker and honourable members, for your time and attention on this important matter, and hopefully your vote of yes. Thank you.
The Honourable Deputy Premier, Minister of Health, has moved third reading of Bill 30, Mental Health Services Protection Act. Those in favour of the motion for third reading, please say aye. Aye. Those opposed, please say no. The motion is carried.
Bill 30, Mental Health Services Protection Act, is now read a third time.